Hello friends. Today we are talking about those 10 signs that your testosterone level is very low, which can put you at risk in the future. When you think of testosterone, what comes to mind? Steroids, macho man, and rage. There is a lot of misunderstanding out there about what testosterone actually is and how it plays a major role in men's bodies. Issues like decreased muscle mass, increased body fat, and erectile dysfunction. You may be experiencing some of these things and not even realize they have to do with your testosterone levels. But should you turn to exogenous testosterone? Is it bad for you? Are there risks associated with higher or lower levels in your body? And are there any natural ways to boost it without taking supplements? Today, we are breaking down all the crucial facts and questions that you might be wondering about testosterone and its major role in your health. Here's the deal. Testosterone plays an important role in men's health and can be linked to certain diseases and issues that may just surprise you. For example, did you know that testosterone is a key player in prostate cancer? Or do women need testosterone too? Also, there's way more to testosterone than just getting swollen. Plus, there are 10 different signs that you may be dealing with low testosterone levels. We're going to go into all of this, but first things first. What is testosterone? Testosterone is the primary sex hormone and anabolic steroid in males. In male humans, testosterone plays a key role in the development of male reproductive tissue, such as testes and the prostate, as well as promoting secondary sexual characteristics, such as increased muscle and bone mass, the growth of body hair, and the deepening of the voice during puberty. For women, testosterone comes in much smaller amounts. Testosterone production in men increases about 30 times more during adolescence and early adulthood. After early adulthood, though, it's natural for levels to drop slightly each year. In fact, they may see a 1% decline after 30 years. How does testosterone work in the body? On a scientific level, signals are sent from the brain to the pituitary gland. This controls the production of testosterone in men. The pituitary gland then relays the signal to the testes to produce testosterone. A feedback loop closely regulates the amount of hormone in the blood. Then, if and when testosterone levels rise too high, the brain sends signals to the pituitary to reduce production. It's important to have the right amount of testosterone in your body. So how do you know if you have low testosterone levels, and when should you be concerned enough to start seeking out medical advice? Here are 10 signs that you may be dealing with lower than ideal levels of testosterone. Sex drive dips. Testosterone plays a key role in libido, aka sex drive in men. Although some men may experience a decline in sex drive as they age, men with low testosterone levels will likely experience a more drastic drop in their desire to have sex. Difficulty with erection. While testosterone stimulates a man's sex drive, it also aids in achieving and maintaining an erection. Even though testosterone alone doesn't cause an erection, it does stimulate receptors in the brain to produce nitric oxide. It's a nitric oxide molecule that helps trigger a series of chemical reactions necessary for an erection to occur. When testosterone levels are too low, a man may have difficulty achieving an erection prior to sex, but keep in mind that there are many other factors at play as well. Low semen volume. Testosterone plays a role in the production of semen, the fluid that aids in the motility of sperm. If your testosterone levels are low, your volume of swimmers may, in turn, be low as well. Hair loss. Although balding is a natural part of aging for many men, testosterone could be playing a role in your thinning hair as well. While there is an inherited component to balding, many men, on the other hand, may experience a loss of body and facial hair when they have lower levels of testosterone. Fatigue. If you find yourself tired all the time, despite getting a full amount of sleep, you may be dealing with low levels. It's best to discuss this with your doctor. Loss of muscle mass. Because of the role testosterone plays in building muscle, you may also experience loss of mass in your muscles if you're dealing with less than ideal levels of testosterone. Increased body fat. Sometimes when there is a disruption or an imbalance of testosterone and estrogen in men in particular, men can experience things like gynecomastia, enlarged breast tissue, or other areas of increased body fat. Decreased bone mass. Men with lower testosterone levels, especially as they get older, may have lower bone volume and are more susceptible to bone fractures and osteoporosis. Mood and mental capacity. If you find yourself with out of the normal depression, irritability, or lack of focus, This could be an issue with the levels of testosterone in your body. Additionally, both testosterone levels and cognitive functions, particularly memory, decline with age. As a result, doctors have theorized that lower testosterone levels could contribute to the affected memory. Low blood counts. Doctors have linked low testosterone with an increased risk of anemia. According to a research article in the Journal of the American Medical Association, some risks and symptoms associated with anemia can include dizziness, light cramping, sleep disruption, an abnormal heart rate, and more. When researchers gave testosterone gel to the anemic men who had low testosterone levels, they saw improvements in their blood counts as opposed to men who only received a placebo. What causes low testosterone levels, and should you be concerned? As we age, testosterone production naturally decreases, but other factors can contribute to low levels too. Injury to the testicles, pituitary disorders, cancer treatments, HIV/AIDS, inflammatory diseases like sarcoidosis or tuberculosis, and testicular tumors are some causes. Low testosterone can lead to hypogonadism, which can cause complications such as loss of libido, reduced physical strength, osteoporosis, and infertility. Testosterone replacement therapy is often used to treat low levels and hypogonadism. Are there side effects of testosterone therapy? Yes, like with any medication, there are risks. Short-term complications include sleep apnea, acne, enlarged breasts, and testicular shrinkage. Long-term use may increase the risk of cardiovascular problems, and there's concern it could stimulate prostate cancer growth. Always consult your healthcare provider before starting therapy. Are there natural remedies to increase testosterone? While testosterone therapy isn't suitable for everyone, natural remedies can help. Zinc, found in whole grains and shellfish, helps regulate testosterone levels. Potassium-rich foods like bananas, beets, and spinach aid in testosterone synthesis. Lifestyle changes such as exercise, adequate sleep, and stress management can also boost natural testosterone levels. That's the breakdown of testosterone. Have you tried testosterone boosters? Share your experience in the comments. Let me know if you want a video on how testosterone levels affect women. Don't forget to subscribe and hit the bell for more content like this. Thanks for watching and stay healthy.